Okay, welcome to the Aural Apothecary podcast, authentic chat about medicines, pharmacy and healthcare in the UK.
Pharmacists Jamie, Gimmo and STC take on topical and controversial stories but keep it edgy yet light-hearted.
Podcasts share their desert island drugs and joyful patient stories.
Hi everyone, welcome to the Aural Apothecary podcast. I hope you're all well. My name is Jamie Hayes. As usual, I'm joined by my fellow apothecaries STC in Bournemouth and Gimmo in Cardiff. It's been great to hear all your messages of support and how much you've enjoyed episode 1 and 2. For the next round of our continuous and quality improvement programme, welcome to episode 3. Coming up in today's pod, we will take a look at the National Learning Report recently published by the Healthcare Safety Investigation Branch. The report looks at the critical and emotional area of support for staff following patient safety incidents. Also coming up in today's episode, our special guest will share their desert island drugs, a career anthem and a book for the Aural Apothecary Library. So, 2 drugs, a song and a book. What's not to like? Welcome STC and welcome Gimmo.
Evening, guys.
Evening.
What have you been up to since our last episode?
Well, I'm trying to fight off the lockdown boredom, to be honest. I thought maybe I should just mention one of my lockdown guilty pleasures, if that's all right. I know you shouldn't talk about guilty pleasures and lockdown, but yeah, so not what you'd expect, but I decided to take up smoking. No, I'm joking. But my guilty pleasure, and I know I've had enough of COVID when I'm at work, but I cannot get enough of How to Vaccinate the World, the podcast on Radio 4 and also on BBC Sounds with Tim Harford. So if you're not listening to that, it's absolutely fabulous. Fantastic guest. It's only half an hour. Yeah, that's what I've been up to.
Very good. Gimmo?
Well, once you take away COVID work, there's not much left really. So just before the podcast, I was on a boot camp on Zoom, which is the way of the world at the moment. So literally 2 feet away from where I'm sitting now, I was swinging a kettlebell, looking at 20 other sweaty people on Zoom. That's the way of the world at the moment. But actually, really good fun. Really good fun.
Very good. Well, I'll match that, and I've just done my cycling class on Zwift, which again was fantastic and really helps get you through these times. I've been a SWAT as well because I've only gone and read Invisible Women.
Oh, wow.
Recommended by last episode's guest, Claire Howard. So, Invisible Women, Exposing Data Bias in a World Designed for Men. Oh, it's essential reading.
Is it?
It is. It is essential.
I was really interested in it because as I said last week, I've been looking at valproate, and valproate's an area where the data doesn't support the area where there's the main problem, which is in women, and so she was right.
And so I was expecting I understand the healthcare chapter about representation of women in clinical trials, and we get that, we know that, but the rest of it, I was blown away by it, sadly. And the Sunday Times does say a book that changes the way you see the world. There we are. STC?
Gimmo, I propose that you have to read Amira's book, whatever it might be today.
Yeah, there we go.
Before the next episode.
Seconded.
A book relay. There we go.
Seconded.
I like that.
Yeah, so that was good.
New feature where we review the previous guest's book.
Yes.
Oh, blimey. Speed reading.
That's a commitment, mind that is. Yeah. Steve's writing checks that you're unable to cash there, Gimmo, okay? Okay, time to introduce our special guest. This episode, we are delighted to welcome Dr Amira Guirguis. Amira is a pharmacist who gained a PhD in the in-field detection of new psychoactive substance. She worked in community and hospital pharmacy, also as an academic and researcher. She is currently the MPharm Programme Director at Swansea University Medical School and a Senior Research Fellow at the University of Hertfordshire. Amira is currently co-supervising a few PhD research projects focusing on pharmacovigilance and medicines diversion, drug abuse and mental health, and drug detection in prisons. Amira was recently identified, as we mentioned at the end of last week's podcast episode, she was recently identified by the Pharmaceutical Journal as one of their women to watch, as one of the 12 outstanding women that will change the face of pharmacy. Welcome, Amira.
Hello, welcome.
Nice to have you on the pod. What did that feel like to be on that Pharmaceutical Journal list of women to watch?
I felt so honored and delighted to have won this award, and it was really good. Like, I was so happy.
No pressure for the podcast then.
No.
Having met you a couple of years ago for the first time, absolutely no surprise that you find your way onto such a list. Absolutely well deserved.
Thank you.
So welcome to the pod, Amira. Let's start by asking you what's on your agenda right now. What's the big thing that's occupying your time? I know you're very busy, but what's the one thing you'd like to share with us?
Well, the number one thing I would like to share with you today is the new pharmacy school at Swansea University, and this is the newest school of pharmacy in the UK. And it's been an honor to be part of a team who's really working very hard in order to establish that new school. So I've been working with Professor Andrew Morris, Adam Turner, Haley Harris, and we've been looking at how we can design a curriculum that's innovative, that is able to produce graduates who are fit for purpose, who are actually going to be working in all of these new jobs that have emerged in pharmacy and changed the face of pharmacy. We've been looking at how we can bring digital health into the curriculum, how to make placements and experiential learning a real good experience for our students, and most importantly, how we are going to have a curriculum that's in line with the newly published GPHC, Initial Education and Training Standards for Pharmacists.
Okay, thank you. Clinically, what's on that sounds a lot, but I know you're very busy clinically and involved in lots of different things. What's on your agenda clinically?
Clinically, I've been working on the vaccine, but also trying to be part of the vaccination program and trying to help and trying to contribute and have a role. But most importantly, I've been focusing on patients or people who use drugs during the pandemic and how the service has changed. So service provision has changed during the pandemic, especially with patients, for example, who have to attend pharmacies every day for daily supervised consumption of methadone. And at the moment, I've been working with a team at Swansea to produce a medical device that hopefully is going to help that issue and help with maintaining people in treatment whilst, preventing these daily visits to pharmacies and maintaining continuity of these services.
So Amira, talking about the students and, as you say, being fit for purpose in relation to the new regulations, does that include trying to go big on preparing pharmacists for being prescribers early on in their career, if not immediately after qualification?
Definitely. We have to look at how they are going to gain the necessary skills and competencies that are required for, to become a prescriber on day one when they register. So, and this includes them mostly becoming scientists, practitioners, always bringing the science into informing the decision making, but also being decision makers as well is very important. Having this competency, hopefully by the end of the degree and before registering, I think is key.
And are you going to be able to use simulation? So, for example, I learned as a prescriber that until you start prescribing, you have no idea really about making clinical decisions and how that changes you, because you learn that if you do something and then something doesn't go to plan, next time that makes you a better prescriber the next time. And so obviously I think that pharmacists, maybe compared with medics, don't get that level of exposure to actually making clinical decisions, and having to work in the grey. And that's something that I think pharmacists struggle with. But I'd wondered if you can use simulation. So almost you can prescribe a combination of drugs to the simulation man, but then, half an hour later he dies, or, he has an anaphylactic reaction, because surely they can learn in a similar way in a virtual world. Is that possible?
I think you touched on a very key point here. I think we are very lucky to be a school of pharmacy within a medical school, a very well-established medical school. And we are building our own pharmacy skills suite as well. So we are going to have our students, learning alongside the medical school students, alongside nurses, paramedics, so other healthcare professionals, but also using simulated practice. Hopefully that should build or help them to build or be equipped with the relevant skills.
Yeah, I was just going to mention that, which you've just touched on, is that I think one of the major differences from when we were students, not you, Amira, I'm talking about us, the rest of us, 20 years ago, was the multidisciplinary approach.
Yes.
It wasn't something, I don't think apart from in the med club, I don't think I saw a doctor when I was at university, whereas now it's a key part of the training, which is fantastic, I think.
Oh, definitely. We are starting this from year one, and it's really key to work alongside. So at least when these students graduate and qualify after that, they know what is the type of communication they are going to have in practice. They know, like when we teach about communication, it's not straightforward, with the doctors versus, with the nurses and so on. But also we are bringing on a lot of digital components to that. So simulation is not necessarily or does not necessarily have to be face to face. But nowadays, technologies in place are allowing students to actually, explore the human body and explore a lot of clinical areas. They don't have to be face to face yet.
I was really interested in the other aspect of your work that you touched on, because I think we mentioned it last week. We talked a little bit about methadone. You are hearing stories in the normal press, never mind the medical press, of people at home who would normally be taking daily doses of things like methadone, and because they're given a week's worth, then they're obviously, for various reasons, coming to harm as a result. Is that the sort of thing that you're involved in?
Yes. So what happened when the pandemic happened and the lockdown happened, we started to see these long queues outside pharmacies, and people go in to collect methadone. They don't want to be seen. They want to go in the pharmacy 1 minute, in and out. And there is a lot of stigma around methadone supply and, methadone collection from pharmacies. And Public Health England allowed prescribers to give up to 2 weeks supply. And speaking with a lot of addiction psychiatrists between England and Wales, I found that some quantities given to patients were up to 2.8 litres. So you can imagine somebody going home with 2.8 litres. So we started to see overdoses, methadone on the black market cheaper than heroin, and also a lot of robberies as well.
I think it's fair to say that the pandemic works in strange ways, doesn't it? It affects so many things without us even thinking about it.
Yes. And therefore, actually, our intervention, unfortunately, I'm not able to speak a lot about it today, but our intervention hopefully is going to help with maintenance in treatment whilst preventing overdoses. Yeah, I'm looking forward to that.
Sounds like a really tough area, but yeah, incredibly worthy. And as I say, just things we don't even think about. Excellent. Well, listen, the other reason for coming on the Aural Apothecary is to give us some ideas of your desert island drugs. So I'm sure you might have thought about this, having listened to the previous episode. So what drug would you like to give us as one of your desert island drugs?
So my first one is St. John's wort.
St. John's wort, okay.
Yeah, and I will tell you why. Because my first research was on St. John's wort. I was just testing it as a type of herbal medicine, not necessarily in the way we think about it as pharmacists, like drug-drug interactions and, all of that. And I come from a cultural background that respect a lot, the herbal teas. And I always drink herbal teas because I know they are healthy and they are safe and all of that. So when I started to look at St. John's wort,
Of course they are.
Yeah. So basically, the outcomes of my research showed that, herbs absorb a lot of minerals, but also a lot of heavy metals. And when I started to look more in detail and looked at the main active ingredients in St. John's wort according to the British Pharmacopoeia, so the main one, which has the SSRI effect, is hypericin. It has a chemical structure that's very similar to some antibiotics. So I started to look into that, and I realized that's why this is when we advise patients, for example, like tetracyclines, we say, please avoid milk, please avoid iron, and so on. Actually, hypericin acts in the same way and complex with metals. And therefore, it's a plant that's naturally complexing with metals. And when we take it, we take everything. So I was doing a talk for pharmacists. And I was still very, very junior. It was my first time to do, a talk to a room full of pharmacists, and it was quite intimidating. So I wanted to bring my research and tone down the technical bits and make it more accessible. Anyway, when I started to think about how I'm going to present that, I presented it with a tea bag. When you put the tea bag in, a glass of hot water, what happens to it? You start to see the color from the tea bag.
Infuses, yeah.
Yeah, that's called water extraction. So you extract a lot of things, what you want and what you don't want. And when I compare that to other formulations like tablets, mainly made with ethanol, for example, you are going to extract different things which dissolve in alcohol. So therefore, it became like, I stopped herbal teas after that. Didn't have any more herbal teas.
So they're not as safe as they might have us believe. Okay, well, fascinating story. I have a St. John's wort outside my front of my house, actually, which is a bit sad. My wife and I are both pharmacists, so that was the give for me when I saw it. We had to have the house, obviously. We'll definitely take St. John's wort, Gimmo.
No, I'm just saying, St. John's wort is one of those funny ones, isn't it? In that a lot of the herbal stuff when I used to work in a pharmacy, you sort of poo-poo most of it. But St. John's wort was one of those ones that was always sort of like, well, what actually can I say about St. John's wort? Can I recommend it? Is it safe? And of course,